A new study concludes that eating more fruit is actually harmful to your liver. Now, hold on a second. Fruit's supposed to be healthy, right? So how can a study showing eating more fruit is actually harmful for your liver and fatty liver disease? Well, this is a classic example of a study that needs a little more looking into rather than just reading the catchy headline. So let's see what we can learn from it. I'm Dr. Brett Scher, the medical director at dietdoctor.com, and this study is called The Effect of a Fruit-Rich Diet on Liver Biomarkers, Insulin Resistance, and Lipid Profile in Patients with Non-Alcoholic Fatty Liver Disease, a randomized clinical trial that was conducted by researchers in Iran and published in the Scandinavian Journal of Gastroenterology. Now, non-alcoholic fatty liver disease, or NAFLD, is now the most prevalent liver disease in the world. And it was actually sort of non-existent back in the 80s and probably early 1990s even. And if you had fatty liver, you were drinking too much alcohol, period. So that's why they named it non-alcoholic fatty liver disease. It really should be named like metabolic syndrome fatty liver disease because it is associated with metabolic syndrome, insulin resistance, and other conditions that go along with that. It's associated with it. Unclear, exact cause and effect, but definitely an association. There are also studies that show, though, it's associated with almost any kind of food, right? Saturated fat, trans fats, simple carbs, sugar-sweetened beverages, and fructose. And different observational studies have all been associated with fatty liver disease. So the question is, though, is it this specific type of food, or is it sort of the dietary context that it's in? And, from my standpoint, when it comes to like saturated fats, it's clear it's not the specific food because you look at ketogenic diets that are unrestricted in saturated fats, and they actually help fatty liver disease. So it's clearly not the saturated fat, but more of the dietary context itself. It's the hypercaloric, combined high carb, high fat type of diet, the standard American diet, that triggers metabolic syndrome and insulin resistance and fatty liver. But then the question is, what about fructose, right? Fructose is in fruit, which is healthy, right? It's been promoted as healthy. So the question is maybe fruit not as healthy as it's being promoted, or is it just fructose itself and like high fructose corn syrup, but when combined with fruit and the fiber and the natural and so forth, that it doesn't have the deleterious effect? Well, this study seems to suggest that fruit itself is deleterious to fatty liver. So let's talk about the trial. It was a randomized controlled trial of 6 months. It was a pretty good length trial for something like this. There were 80 people randomized to either eating more than 4 servings of fruit per day or less than 2. In the end, it turned out to be 7 in the high fruit group to about 1 in the control group. Everybody had NAFLD, but was not obese. Their BMI was less than 30, so overweight but not obese. And actually, if they didn't adhere to the diet, they were excluded. So it wasn't just intention to treat, it was what they actually did. So there were 72 participants in all when it came to evaluating it. Now, let's jump to what they found. What they found was the people who ate more fruit, their liver function tests were significantly worse. As an example, the ALT went from 38 up to 89, which is a really significant increase, whereas in the control group, it went from 50 down to 32. And similar things, triglycerides went from 183 all the way up to 248, which is ridiculous. And in the control group, it started higher at 242 and came down to 153. But here's the kicker, the weight change. In the fruit group, the weight went from 79 kilos up to 86 kilos, so a 7 kilo weight gain, whereas the control group went from 78 kilos down to 71 kilos, a 7 kilo weight loss, so a 14 kilo difference. That's pretty significant. So right away, we have to ask ourselves, well, was it the fruit or was it the weight gain that made the fatty liver look worse? Because they also looked at the severity of the steatosis, or the amount of fat in the liver, and it went up significantly in the fruit group and down in the control group. So it was clear the intervention group of eating more fruit significantly worsened their liver function. But was it the fruit or was it the weight gain? Hard to tell. And how can you gain 7 kilos just by eating a little more fruit? Well, what did they define as the fruit? Was it just, low sugar berries? No, it was pretty much anything, including dried fruits. Remember, this was in the Middle East where dates are huge. Dried fruits are a big thing. And that's also very different than eating, just regular fruit that hasn't been dried, because the concentration of the sugar in that dried fruit, the sugar to fiber ratio and the energy density is so much higher in dried fruit than it is in regular fruit. So that's another thing to consider. And also importantly, the fruit group, it was eating more than 200 calories per day in excess compared to the control group, right? So again, so many things change just by saying add this fruit. You're eating more calories, a lot of dried fruit as well. You're gaining more weight and saw worsening of your fatty liver. So again, was it the weight gain? Was it the fruit? Hard to say. Now, the authors did do secondary analyses, and in those analyses seem to suggest that it was not due to the weight gain, but I always caution about those secondary analyses. It really weakens the quality of the evidence. So there's a suggestion that it's not the weight gain, that it's the fruit itself, but I'd say that's much less certain than just the fact that there was a significant change and it's unclear what it was due to. And the authors point to other studies that have been done, such as this Cantero study, which used calorie restriction with fruit, and it actually improved NAFLD. Now, the intervention also lowered the carbs, right? The intervention group was 40% carbs versus the control group, which was 55% carbs. And in that study, they reduced their calories. So very different, right? Very different setup. They reduced their carbs, they reduced their calories, and they included fruit, as opposed to this study, which just added fruit onto the diet, increased their calories, and didn't bother decreasing their carbs. So what can we conclude from this? Well, I would stop short of saying this shows that fruit is dangerous and is going to drive your fatty liver disease. But what I would also say is this clearly shows that fruit doesn't have this halo around it that gives it a free pass, that eat your healthy fruits and just by adding fruits, you're going to be doing yourself good. No, you have to ask yourselves, what kind of fruit? Are you replacing something with your fruit? What's happening to your overall calories? Because if you are in caloric excess with too much fructose going to your liver, that makes sense that it will potentially harm your liver and worsen your fatty liver disease. But if you are not in caloric excess and your body is burning fructose, then maybe it's not going to have the same, if your body's converting the fructose to glucose, you're using that energy, then maybe it's not going to have the same effect because you're not in caloric excess. It may not have the same effect on your liver. So this study didn't look at that specifically. So again, I stop short of saying fruit is automatically dangerous because of this study, but also stop short of saying fruit is automatically healthy. And what matters is, what are your total calories? What are the makeup of those calories? Are you a fat burner? Are you not a fat burner? Are you utilizing your glucose that you ingest? Or do you exercise right after eating your fruit? All those things can play into this. But of course, that's a more complicated conclusion than just saying fruit worsens liver disease, avoid it, right? So look, there are plenty of people who eat low-carb diets who only eat a minimal amount of fruit, if any, and that's fine. They can do that and be perfectly healthy. And then there are people who are on plant-based diets who are eating a significant amount of fruit, but as long as they're not in caloric excess, as long as they're not in the high-fat, high-carb, high fructose corn syrup group, they can do that as well, and remain perfectly healthy. So, dietary matrix really makes a difference, and what your baseline diet is makes a huge difference. So don't fall for the headlines. Instead, look a little deeper. Hopefully we helped you look a little bit deeper today and understand this a little bit better and put it in perspective into what it might mean for you. All right, if this was helpful, please click thumbs up and subscribe, and we'll see you next time here on Diet Doctor News on YouTube. Thanks a lot, everybody.